Hi, I'm Kat Jersich, Senior Editor for Healthcare IT News, here with Tracy Russell, Nurture KC's Executive Director. Tracy, thank you for joining me today.
Thank you so much for having me.
Let's just get started by talking a little bit about Nurture KC and your work to address the maternal mortality crisis. Could you tell me a little bit about that?
Nurture KC is a local program. We actually cover Metro Kansas City on both sides of the state line, so both Missouri and Kansas. And our flagship program is called Healthy Start, which is actually a federal program that's been around for a couple of decades. And we serve pregnant women and their families from the urban core. And what that comes down to is the 14 zip codes of Kansas City, Missouri, and Kansas City, Kansas, with the highest rates of infant mortality in the area. And we have a community health worker model. So we serve from our office directly and do home visits with moms, as well as we have community health workers in two federally qualified health centers in the city. And, you know, I always struggle a little bit with explaining the scope of what the community health workers do because it's so much. Really walk alongside these women throughout the birth process and after, because their infants up to 18 months old remain enrolled in our program. And so I think that really shows a commitment to making sure that we live up to that Healthy Start name. And then we do a warm handoff to other agencies after that point. But we tackle everything from getting moms enrolled in health coverage to providing monthly diapers once baby's here. We provide cribs and car seats along with safe sleep education and car seat education. We help them develop a reproductive life plan. We help with breastfeeding resources and so many other life issues. You know, I've talked a lot about, I learn every day new things that our community health workers are doing. Like in one instance, we had a mom who didn't have a driver's license. A huge barrier for her in terms of employment. So her community health worker got her on that path to getting a license. We have had several moms this fall who have found themselves homeless. And we have been working to get them into housing, and we've been able to successfully do that. So it's so many life issues that present, and all of our community health workers either have a social work background or a health sciences background or both. So they're uniquely qualified. These aren't, you know, just people who come in and have a servant's heart. They really have the experience to go along with it. And one of our Healthy Start staff was actually in the program at one time.
Oh, that's amazing. You touched on something I did want to talk about, which is, I think, unfortunately, there's kind of a misconception about maternal mortality that it is limited to the birthing experience. I think even advocacy can sometimes focus wholly on the day to 3 days to a week that a person can spend in the hospital having a baby. But we know that there are other factors. There's a whole person experience that goes into maternal health and infant health by proxy. So given that, what do you see as important steps to promoting health and wellness among women and children and others that are affected by maternal access to care?
I put it really candidly in that let's stop treating moms as incubators only and look at it from a whole health perspective. You know, I think when we begin to look at wellness and how mom is doing from both a physical and a mental perspective, we're going to have much better health outcomes in this country. And what we've experienced right now is simply unacceptable. You know, the United States continues to rank very poorly around both infant mortality as well as maternal morbidity and mortality. And we know what some of the remedies are, and why aren't we enacting that? And I think, you know, I've been with Nurture KC for 3 years. And at that time, maternal mortality was just beginning to be discussed. And so now we've had at least 3 years of discussion on this. Where does the action come into play? Because we're not seeing as much of that. And, I was watching very closely, just yesterday with the Build Back Better plan, what's in there around maternal health, because we keep talking about it and it's unacceptable. But yet those seem to be some of the first items that are discarded when it comes to action. I look at it from both a direct service perspective, as well as what's happening within the healthcare system, as well as what are we doing around those broader policy goals to really bring about the cultural change that you need. And so I think we get real simplistic when we talk about this issue, instead of recognizing there are a number of drivers. And when we look at maternal mortality in particular, over half of those are occurring post-delivery. So these are issues that may present during pregnancy, but clearly they've been there prior to pregnancy. And, it points to access of any type of healthcare. It speaks to the huge racial chasm that we have in this country, yet to address, but really crystallizes around birth. And certainly we've seen that with the pandemic as well. And so I think we have to start addressing those at the policy level, at the systems level, and just within communities through direct service.
Absolutely. I mean, you touched on something that I was going to bring up in my next question, which was, I think it would be a journalistic failure to not acknowledge the fact that the maternal mortality crisis is disproportionately affecting women of color, especially Black women. So when we're talking about advocacy and when we're talking about these direct steps and these direct actions, how can both policymakers and advocates and folks doing direct service center those most affected when it comes to improving the crisis?
I think the first thing really is recognition that the problem exists, because that has been an uphill battle. And so I think within those clinical settings, providing training to physicians and recognizing that this is a very important aspect of it, in terms of recognizing that we all have biases and that we need to look at those. There's been study after study that women in general may not be listened to when it comes to healthcare. Black women much more likely to be dismissed in that regard. And so I think that's a first step to do. I think we also have to recognize that access to care disproportionately is impacting Black women. If you look at, from the numbers we've seen, first trimester prenatal care, much lower for Black women. And certainly, you can attribute that to transportation or lack of health coverage and all of these social determinants of health that play a role in this. And that when we look at health equity, it's not offering the same sort of benefits to everyone equally. It's recognizing, where do we need to do more to shore up these outcomes? Even when you look at family and medical leave that's paid, Black women are much less likely to have access to that. And we know that as symptoms present post-birth, why wouldn't we want to ensure that all of our moms have access to some paid family leave? Because I guarantee you, our families are some of the first who have to go back to work after birth.
Absolutely. And the effect of that on a person's mental and physical health after an incredibly, and at the very least, an intense event, often traumatic, often medically significant, I can see that being quite enormous. So
yes, and I think the mental health issue, I'm glad that you brought that up, because when you look at the disparity there, It is so significant, and particularly within the Medicaid program in terms of scarcity of providers. And we know that particularly for Black women, they may be dealing with a number of more intense types of stressors in life, and they don't have access to that. Mm-hmm. So I will say that internally at Nurture KC this year, we started offering group therapy for our mothers in the program dealing with postpartum and perinatal mood disorders as a way to begin addressing that. And I know that that's just a small piece of what needs to be done, but the mental health piece has just been ignored for so long. And I would say, again, almost dismissed. It's just, the baby blues. And I think the more that we have an emphasis and a connection between physical health is mental health, then we'll get to a better place.
That's very well said. As you know, I'm the editor of Healthcare IT News, the senior editor. So we do a lot of work about digital health tools. And so I'm wondering whether you've experienced any impact at Nurture KC from using tools like telehealth or other connected health technology to assist with moms, and whether there's anything you can speak to about that.
Sure. I think telehealth is a key tool that we're not utilizing nearly enough. And I know it's often pitched as this is what we need in the rural areas. While that's true, you need it just as much in the urban areas. Our access issues and transportation issues may look different, but that outcome is the same. It's lack of access. And certainly, like with our counseling sessions, we're doing those remotely. When the pandemic hit, we went to serving our families more in a remote way in terms of their visits. Now, they would still come by the office to pick up goods, but I think you have to be able to meet people where they are and recognize that you don't want to be the barrier to them getting what they need. And so I see a huge role for telehealth going forward. And I think, if nothing else comes from this pandemic, certainly showing us that we can evolve and adapt via technology will be a great tool to utilize.
Absolutely. Well, thank you so much for your time. I've really enjoyed this conversation. Is there anything else you want to add about next steps to addressing the crisis in the United States?
I think, the data collection is the first step. And we had put together a report on maternal morbidity and mortality in Kansas and Missouri this summer. And I was shocked at how difficult it was to compile the information in one place. You get bits and pieces across different agencies. And I think there's no way to measure your outcomes and make sure that you're pursuing what are appropriate actions and effective actions unless you know what the data says. And I think that's one of the beauties of our program is that there is benchmark after benchmark due to our federal reporting requirements. So I know exactly how we're faring on a day-to-day basis. And we can be very nimble in that regard in terms of, okay, well, this clearly isn't working, so we need to figure out another path. And so I think if we can begin to move from just talking about these issues to really making some substantive actions, that we'll start to see that trend bend that we've had for so long.
I hope so. Thank you so much, Tracy. This has been a great conversation, and I appreciate you taking the time to speak with me today.
Thank you so much. It's been great.